So in the United States, we spend over 8,250 per capita on healthcare every year, and that's 22% higher than the next highest country. And then the estimated percent that we spend on healthcare that is wasted is 30%. So like a lot of the money that people are spending on healthcare doesn't like benefit anybody. And then even though like we have like this really high like paying stuff, we're not ranked the highest for like life expectancies. We're like 34th highest in 195 countries of the world. So like the fact that we're paying so much money for healthcare and we're not like getting the best benefits, I guess, it's kind of like And then in a recent study found that a lack of insurance coverage can be tied to 45,000 deaths per year in the United States, which is a lot.
Okay, so
Yeah.
to add on to the idea of all those deaths, including the people who have no health insurance, is that what you said? So in America, it's not required to have health insurance. So what our government does is we create something called Medicaid or Medicare and Medicaid, which is Medicaid is for adults that are well over 65, I think.
Yeah, that's
65 years
And
old.
then Medicare is for the people who may not be able to afford the health insurances that middle class workers may be able to. So the issue with that is some people are receiving this health care and they don't get the benefits, they don't get the doctors, they don't get the medicine that some of the people with the higher health cares do. So in that instance, when they receive that, some of them don't even really have to pay for it if they're at that low of income, which is not a bad thing at all if you really can't do it, such as if you're handicapped, the handicapped people, or if you're disabled or anything of that sort. While there are the group of people you were talking about, the uninsured people who cannot receive any health insurance, but at the same time, you are not allowed to be denied if you go to a hospital, but you will be cause of charge of money. So the hospitals are going to tell you you have to pay this, you have to pay that, and it's probably going to be an extreme amount of money. Just as Jay said with the pharmaceuticals, you could buy 5 pills and at least one of those pills has got to be at least $60 each. So some people are going to say, you know what, I might be sick, but I'm not going to go to the hospital because it's going to cost me a lot of money, which then that's where we find what Sarah said, the deaths are really, really high in that area. So
Yeah. And on top of that, insurance in the United States has had so many problems with it since the introduction of the insurance running the healthcare system. So from 2010 to 2016, out of 100 senators polled, 99 of them received payment from insurance companies, and 10 were paid over $10,000. So, like presidential candidates, Bernie Sanders was paid $37,000, Ted Cruz got $41,000, and John McCain got $27,000. So all these public figures are just being paid by these insurance companies. So they don't really have any incentive to protect the people anymore because they're getting so much money from these insurance companies. So they're gonna lean toward helping the insurance companies out. And so this is moved on to individuals in the market spending. The spending has increased 18.3% per enrollee in 2017, and this is going to cause a lot of people to go bankrupt this year. And so at the federal level in 1990, the government spent 14.4% of all of its federal outlays of spending on healthcare. And in today, in 2017, it spent 31.1% of its spending on healthcare, which is just astronomically high. So if the number one thing we could do to help out in this area is to re-regulate the healthcare system, and as far as insurance is concerned, because in that field they're making so much money. They made $4.6 billion of profit last year, which could have been and if you make $1 billion in profit, if you're a business, that's really, really successful. And they're making $4 billion, and their job is to help people. So all of that $4 billion could have gone instead of into paying these CEOs massive salaries so they can be millionaires, into
The people.
the
who are-
people who need the help most, like
I do agree with
the
that.
people who are covered by Medicare and Medicaid.
I feel like the difference between like here or like in the United States and everywhere else is that the doctors get paid a lot more here.
Yeah.
And so like I think that really puts like an effect onto like who really decides to go to the doctor. Because technically even if like the doctor is messed up, like they're still getting paid. Like they don't care. So
Well, they do have a malpractice insurance also, which is another major thing that our healthcare industry provides to the doctors. So if they do mess up, it wouldn't quite be on that person's dollar as much, while that malpractice insurance for the doctor also saves them. So then it goes back to the health insurance company to where they're kind of in trouble, you know, and then it's all one big messed up circle. But
yeah. The average person visits the doctor here